This patient was referred to me a year ago for endodontic treatment of tooth number 19. She had received a crown, and afterwards, tooth had started to hurt a lot, temperature sensitive, and pain to biting, chewing, and also spontaneous pain. So when I saw her, we diagnosed the tooth as irreversible pulpitis with acute apical periodontitis and recommended root canal, and patient agreed. So you can see here's the date, a year ago. This was immediately after we had done the root canal. Again, we did the root canal in one appointment, went through the crown here, and as you can see, 4 canal systems. And again, we did the root canal in one appointment, and this is immediately after we finished the root canal treatment. You can see 4 canals, 2 mesials, 2 distals. I got a gap there, and some sealer extrusion here and here. Doesn't matter. Does the gap matter? Does the fact that we did the root canal in one appointment matter? Does going through the crown matter? Does sealer extrusion matter? And again, as you can see, when we did the root canal 1 year ago, all right? And this was just now, today. Patient came in so we can examine a different tooth, and we always take radiographs of the root canals that we've done to make sure they're doing okay. She still has the same crown. Endoaxis was restored with composite, so it's the same crown, and no symptoms. Tooth was in full function. But what happened to my gutta percha and sealer? So yeah, what happened to my sealer? See, the thing is that I use the injection technique of gutta percha. So in some instances, not all the time, but in some instances, I use the injection technique of heated gutta percha. And parts that usually is in the apical areas of the canals, they get filled with sealer only, which is okay, as you can see. I have a few cases like this. So the sealer resorbs, and the gutta percha, of course, remains. So that's what happened. That's what happened. But as you can see, it's fine. That's what I always say. And there are multiple studies, the most famous one being Dr. Lin's study, that says the extent of obturation does not determine the success rate or failure of endodontic treatment. So what he's saying, Dr. Lin's study is saying, is that you can fill short, you can fill long, you can fill flush. It's okay. The extent of obturation, it could be short, it could be flush, it could be long. It's all right as long as there are no microorganisms in the canals. And this is another example here, as you can see. The sealer got resorbed apically. The gutta percha is remaining. Now the gutta percha is short, as you can see, but it's okay. It's been a year. So if there were any periapical reluces, any issues, we would have been able to see it. And here's the date, as you can see. So I had another case like that too that I presented a few weeks ago, and I asked, why do you think this happened? So in this case, I summed everything up, so now you know. Here it is. 1 year post-op of tooth number 19. Again, tooth is in full function. Asymptomatic, no periapical relucencies. Excellent. Rest in peace, Dr. Lin.